All right, welcome back to the show. And today is Wellness Wednesday, and as per usual, we talk about anything and everything health and wellness and lifestyle and everything in between, okay? And like we said when we started the show in the first hour, that is December 1st is usually celebrated. That is World AIDS Day. And of course, as we do not want the day to just end like that, no, we need to continue with the conversation and just take stock of where we are at as a country, what are some of the hits, what are some of the misses, and what we need to do, okay? So the conversation, this morning is just, first of all, talking about hope, okay? Because most of the time when we talk about HIV and AIDS, it's usually, oh, okay, we share and whatnot. No, but today we need to focus on hope as well and giving people hope. So it's an amazing conversation that we're about to have, and even just looking at the numbers as well, which Dr. will give us more numbers in terms of the new infections that are in the country. But again, the data just shows that between 1.3 to 1.4 million people are living with HIV right here in the country. And we've made so much progress when it comes to HIV and AIDS, but even at that, there's so much that we need to do, okay? So my panel this morning, I'm just gonna start on my immediate left. And we have Dr. Eric Wanyoike, who's the CEO of Spark Limited and also AI Healthcare Consultant. Good to see you, good to have you. Karibu sana Daktari. And we also have Lois Atieno, who's a program manager, Maono Africa Center for Transformation, Karibu sana, and also an advocate. You speak so much as far as HIV and AIDS is concerned and what we need to help, especially young people, right? Yeah. Okay, and we also have Christopher Amuyunzu. Amuyunzu sounds from like my side of town, but we'll talk about it maybe after the show. Christopher Amuyunzu, who's a youth champion and as well as living positively. Karibu sana. Thank you for making the time really to come and join us in this very important conversation. But Doctor, let me just start with you. So we've made tremendous progress, right? But there's still a lot of misinformation and disinformation, which we'll talk about in just a second. But can we talk about the reality of the situation right here in the country? How are we doing? What are the numbers saying? And especially when it comes to the new infections.
Well, thank you for having me. And this is a very timely conversation because recently we've seen a spike in the numbers of new HIV infections. Yeah. We are currently talking about 19,800 new infections, which is an increase to 19% as opposed to the previous years where we were at 16%, at around 16,000 new infections. That is, it is concerning. Yeah. And we need to understand that when we see such things, such numbers coming up, we need to rethink and take precaution because in 2013, we were having about 100,000 new infections annually.
Year, yes.
Okay. It came down to a point we were down to about 12,000 new infections annually. Then we've come back up to 19,000. Yeah. So that is concerning. Yeah. So in terms of the numbers and where we should be, we are taking the wrong curve.
Yeah.
Yes.
Yeah. And I know there was a lot of conversation about 95, which was first of all 90, 90, 90, and then 95, 95, 95, which we'll talk about a little bit as we continue with the conversation. And someone might ask, with a lot of awareness and with a lot of information out there, why do we still see these new cases? And also just talk a little bit on the young people, the age group that is mostly affected, because we know women, are more affected, but also when it comes to the different age groups as well.
That is an interesting conversation to have because when you look at the, like you said, the numbers, especially for women, being higher than men, you also have to pose the question about testing and compliance. Okay. To see a true picture. Additionally, transmission from maternal child transmission has also slightly increased with the last statistics. Yeah. Looking at the matrix of the issues that are going on currently, we've had a couple of challenges from the funding aspects for HIV solutions. We have certain challenges.
Yeah.
And we could be having a backlash of some of those challenges to see some of these numbers spiking.
Yeah.
But we can't entirely point a finger on that because, you know, different organizations have tried to take the necessary solutions to mitigate that 4% of funding that was lost from PEPFAR. An organization like USAID shutting down had a profound effect on the same. You know, I mean, for persons living with HIV, where they used to get their drugs, for example, going to meet new or being asked to go to different centers to collect your medications.
Yeah.
Such issues affect compliance.
I see, I see. And also, let's just to drop you in, because again, you interact a lot with the young people. And we see even from the numbers that, especially with the new infections, are actually, you know, rising, and especially with the young people, right? So what are the conversations that are happening? Where is it that they're saying? Because there's a lot of jokes, you know, where people make and say, oh, now young girls are more scared of pregnancy than, you know, HIV or something like that. So can we talk about some of those conversations that are ongoing, and especially in relation to HIV AIDS?
Thank you so much, Winnie. Thanks for having me on the show. My name is Lois Atino. I work for an organization called Mono Africa, Center for Transformation.
Yeah.
We are based in Dandora, the eastern parts of Nairobi. And with that regard, you're so big on sports and arts. So we use sports and arts as a tool to drive social change and development.
Okay.
With that regard, young people are drawn or they're attracted to the center with matters football, with matters dance, with matters modeling, you know, just a talent bit of it.
Okay.
So once they're here, we have this conversation on matters HIV. What does it look like? You know, as a young person, if we just say, go and test, if we preach the ABC, what does it look like? And I love the fact that you've mentioned that we have this rumor going on that girls are more afraid of pregnancy than HIV, which is very true. You know, they believe that pregnancy will show, but HIV won't show. Like, you can't tell if someone is living positively or not. So how does that look like in terms of us talking about matters prevention and also testing, as Dr. is mentioning? The threat is there, but the lack of correct information at the community level to these young people is what is lacking, because they have the information. Okay. You know, we see young people knowing about PrEP and yet not going for a facility to take it. We see the issues of condoms, you know, being on stockouts. But as young people, are we ready and willing to use these available commodities with regards to HIV prevention? So the numbers are rising with regards to new infections among adolescent and young people, basically from the age of 15 to 34, which is so alarming. And we need to rethink our strategies in terms of the message we're putting out with regards to prevention of HIV and AIDS.
I see that. And Christopher, can we just talk about, first of all, as a young person living positively in this country where there has been a lot of information, there has been a lot of awareness and campaigns ongoing, but still we see, you know, a spike in you know, the number of new infections. And then we'll talk about, you know, when you first of all found out that, you know, you're positive.
Thank you for having me today. And my name is Christopher. HIV positive since when I was born. Okay. To your question is that information is out here. But now we have been ignoring a lot of things as stakeholders. The demands that young people are requesting, but now when you put in the table, they tend to take too long to happen. Okay. For example, in 2022 we did a scorecard survey just to analyze and see why young people don't access services within the facility, why young people don't access contraceptive, why young people don't access such like condoms. You might find they'll send one person to pick condoms for them. So now they'll come with this gunia thing and put
it's just
and put condoms for the people in the community. And we found out that young people fear, you know, fear meeting different people. For example, previously I would come for my HIV medication, and then when I want contraceptive, I'll be sent to another person. And then when I want to go to pick condom, I'll be sent to another person. And then when I want to be treated about STI, I'll be sent to another person. And that's where the essence of integration came in. But now the integration was defined differently. Integration was, I receive services within holistically within a room. For example, if I want HIV services, I will receive maybe for in a particular room with a single clinician. If I need family planning method, the contraceptive, I will receive in the same room. If I want to be treated on STIs, I will receive in the same room. Maybe I will just go for testing in the laboratory to get. But now the integration has switched the conversation, whereby now it's infrastructural, whereby we're changing the CCCs to merge with the facility. And of late, we've seen our numbers going down because young people are not feeling comfortable going. For example, I'll go to the reception and give them my card if I don't want to talk about myself. So I'll give them my card, and then they'll say, where do you want to go? I want to go to see the clinician. My card speaks it loud, you get. And then I got the clinician, start the same question. What are you here for? You get. I'm here for my medication. And then I go to pharmacy, I find another person, the same thing. What are you here for? You see, it's frustrating. And someone will say, Kwan, is it a must? Let me just go. And then the previous model, there were those, I can pick my medication from a spot outside there, maybe pharmacy or something. But now, because there's this mix and match of integration, then I'll have to come for the medication within the facility, so that you get. And then I've heard doctors saying that there are more numbers for female than male. Using data, it's correct. But now practically within the community, it might alter kidogo, because most men don't access the facility, and this data that we are using, it's come from the facility. So there are a lot of unidentified people, young people outside there, who are not identified or who are not tested for this. So if something is done, maybe to reach them within their own comfortable spaces, then we might have change in numbers and see there's a bit of fluctuation in terms of the numbers.
That's very interesting, and also just on the danger of that. But yes, go ahead, Lois.
I'm just thinking on, Chris is mentioning something about men are not in the facility in terms of their health-seeking behaviors. And I'm just thinking, where are they located at? Where are they chilling at? Where are their chill spots, you know? And we have these young people chilling in youth centers, chilling in, they call the base, you know, pale kwa mtaa. So how can we get to them, you know, as practitioners or frontline workers on matters HIV prevention? How can we either take the services to them? Because if they're not willing to come to the facility, then we need to take the services to them. And we need to work very closely with these centers, with these youth centers that are available within our communities. I think that could help in terms of making sure we get to these specific cohorts.
And also on the same note, I want to commend what Mauno is doing, because that's one of the attraction points where young people will come. If you put sports, if you put arts, if you put dancing competition, young people will come. You get. And then now that's where you lose that opportunity to test, to give information, to link, to refer, you say. But if we focus so much on the health centers, then we'll be losing.
And also, Doc, just on the danger of itself, because then what you're bringing up is very concerning in terms of how many people are just walking around, not tested, don't know their status, and probably might be going around infecting other people who don't even know. How big of a concern is this from a medical perspective?
We have a huge challenge as a nation, because our health culture, our health-seeking behavior is reactive.
It only, when it hurts, is when you go to the hospital.
We have a very reactive health-seeking behavior. And we need to have that mind shift and have a more preventative approach to healthcare. In terms of education, I've seen some data purporting that only up to 60% of Kenyans have proper information on HIV and AIDS. That's the data. HIV and AIDS has been spoken about even in our vernacular. So what is the challenge there? So we have a challenge of education.
Okay.
And where should this education start? When I was younger, we were shocked some time back by some videos of, some STIs, and that was in primary school. I don't. Now we have a challenge because I don't think you can speak openly about sex education in schools. All right. And our children are not the same like the way we grew up. They're exposed to tablets, they're exposed to a lot of information.
Yeah.
If this information is not guided, we have a huge challenge, a huge burden. Now, education needs to start very early as in primary school.
Okay.
All right? Parents need to speak to their children about these issues. That's where the information is, just from that information point.
Yeah.
Then you would have a generation that, is conscious about their health-seeking behaviors. So I want to be preventive, I think that is very important.
I see.
Yeah.
Okay. How about we take a break, and then when we come back, would want to understand. So fine, we've made tremendous progress, but then again, we're seeing a spike in new infections, and we've spoken a little bit about the gaps that are there, and especially when it comes to our health-seeking our behavior as a people, as a country, and even our attitudes really towards HIV and AIDS. So then, what is it that we need to do different? Maybe, like you said, probably incorporate AI into the conversation
we'll have a conversation about AI.
Okay, so there's so much to come on the other side, of the break. Please do stay with us. There's so much that we really need to discuss, but for now, let's pay our bills. We'll come back and discuss further as far as HIV and take stock of what is happening here in the country. Right, welcome back. Of course, the show continues, even during the break. The conversation of the second hour is on HIV and AIDS. We're looking at the progress, the challenges, and the way forward. And also, we're saying the Red Ribbon Special, hope, health, and healing, okay? Well-being, really, as far as HIV and AIDS is concerned. And during the break, Lewis, we had several concerns. Can we just start with those concerns? Because of the numbers that Christopher pointed out, in terms of our health-seeking behavior in just a second. But before that, remember, there's a question that we're asking you this morning, and the question is very simple, okay? We're asking you, do you know your HIV status? And if not, what stops you from getting tested, okay? Do you know your HIV status? And if not, what stops you from being tested? That is the question. So indulge us, okay? It's NTV Kenya across all board on our digital platforms and also on our WhatsApp number, 0112 500 400, and tell us, do you know your status? Okay, and if not, have you been tested? And if you've not been tested, what is stopping you from being tested? Okay, but even as we, wait to look at your feedback in just a second. Yes, Lois, several concerns during the break, and especially as far as these numbers, that we are seeing here in the country.
Yeah, so I had concerns around where are we getting these young people? Like, where are they chilling at?
Yeah.
If we are having fewer numbers in terms of male going to facility to get tested, then we need to take this information to them.
Yeah.
And Chris was talking about us as an organization, Mono Africa, incorporating the use of sports and arts, just to attract and also have this conversation on ground with these young people. How does that look like? How can we report it?
Yeah.
Doc was also mentioning something around AI. Like if I test myself and I get my results, can I link it to an AI ad for it to maybe go to the database, But my concern is that we have the medical data, which is was out, shared by NSDCC, and we also have the non-medical data, which organization like us, Mono Africa, we have, in terms of prevention. How many people have we reached with regards to awareness creation? We do community outreaches using magnetic theater, and we get these numbers. We get to interact with this community. We get to have this conversation, like the question you've just asked. Do you know your status? And for you to know your status, what are some of the steps you need to take?
Yeah.
But how can we record such data? For the ones we have who are on care, if if not getting the data from the facility, how can we be used as organization to get this data, you know, and just create awareness, just to be at par with this matter.
Yeah, and Doc, I'll drop you in just a second in terms, because now we also have Data Protection Act.
Yes.
Okay, so is that a big impediment when it comes to getting the correct data and numbers, you know, and especially not just on new infections, but even, you know, people who live with HIV and AIDS. But Christopher, I want us to understand from you and from where you sit, because I want to believe you also talk to young men, right? So what are they saying? To the facilities as well. What is the biggest challenge, say, for them?
So I'll speak specifically for men.
Okay.
Men say they provide, so they don't have time to go to the clinics.
Oh.
They say that, for example, when they're feeling ill, the community has strengthened men in a way that you're strong, you just need to move on with life. You get like going to seek help in the health facility is weakness. You get.
Okay.
So this conversation we've been having with them and just understanding their point of view. Why do you feel like when going to the hospital is weak? Because, for example, STI, until someone is really, what do I say?
Anaumwa sana, quote unquote. Okay.
Anaumia sana.
Okay.
Njo ataenda.
Yeah.
But just the early signs, no, they will not find time. As long as they are walking, as long as they're having this normal life, then they will not go. Same as HIV. HIV, you find, like, for example, me. I'm normal. I don't have anything like you can say. I'm HIV positive. You get, and I'll say I'm okay. I don't need to take medication. I don't need to go and test. You see, even if someone will just. Even if we'll have a roadshow and say people to go and test, someone will say, look at themselves and say, I look okay. I don't need to go and test. So they will prioritize other things like work, like maybe mostly they're saying it's tough economical times. So they have to look for money. And if even in the clinics, you'll find that those who have partners, they're sending their wives. Take for me medication. You get, even if their very low test is due, they will still struggle finding them because of now that providing structure thing. So those are the few things that they mentioned.
And also, again, like we said, there's a lot of information out there, but still we have pockets of stigma, you know, here and there. And I just want to understand from you, because again, like you said, when someone looks at you, though, no one would say, you know, that you're living positively, right? But do you sometimes feel, oh no, I cannot disclose, you know, this part of, you know, information about myself, because people will be like, once they find out, they'll be like, you know? So do you sometimes feel that, or there's literally no form of stigma that you've experienced, you know, so far, given that we have a lot of information out there?
Stigma that I've experienced is a while ago, not currently. In fact, I'm not checking with stigma so far. But for my young people, you find that someone is living, maybe, for example, in Langata. They will travel all the way to Makadara to go and test. The fear of unknown. Maybe they'll find a neighbor there. Maybe they'll find someone there who will go and spill over. Isn't there's that self-stigma within themselves? Even if someone is not even concerned about you in the hospital, then they'll just feel that maybe I'll be known if I go and test there. Even when they reach there, they'll look for someone like me. Who I don't test, but they'll say, I want to test, and was the procedure? Oh, they had a condom burst. What should I do? And I tell them there's a particular procedure before you get the medication. You need to test, and then someone say, if it is testing, check I. You get. So I can, and there's one who asked me, are you the one who's testing me? Kambia, no. Is he a he or a she? I told them it's a she. And I told them, she's friendly. You just need to go there. I'll be there. Okay, I'll help you in terms of reaching to that place and creating the environment for you, and then you test and say, okay, it's okay, let's go and test. So there's those fear of unknown about how they will be judged, how they'll be seen. For example, if they had a condom burst, or they are living with someone who's positive, or they just have some suspicious about their ladies, or they have multiple partners. So someone is coming to tell you, I have multiple partners, I want to test. You look at that conversation, how it looks like, and they will not tell you that unless you create that environment for them to open up and tell you what exactly they are going through.
Yeah, interesting. So Doc, then, wow, it's a lot of things, because you see, majority of the times we just think, people will go get tested and whatnot, but there's that fear that what if I am told that I am positive? So then how do we make it easier, for people? How do we make it more sort of like accommodating, more friendly, like you're saying, so that we have as many people out there go and get tested? Because it's true, there's so many people who really don't know their status and they're scared to go get tested.
I think I would look at it, and I would like to start from the A, B, C, D of HIV, because it covers that extensively. A is abstinence. We know about abstinence. B, be faithful to a partner, single partner. C is correct and consistent use of condoms. If you're a high-risk group or you have multiple partners. D is detection. So get tested early, detect the infection early, and once you detect the infection early, you start on treatment. Now, he has lived, Christopher here has lived positively his whole life.
All his life,
because of, I'm sure, consistent taking of medications and checking your viral titers frequently, to a point that where you have very low titers, undetectable viral titers. In that kind of situation, there's no spread. People are living. We did talk about discordant couples. A person who's HIV positive and one who's not positive, and they are living well with the right guidance, medical guidance. Speaking on screening, screening is very important, and this is where we are always trying to make advancements in how testing will go. And in the next 5 years, most test kits will have AI incorporated. 5 to 10 years, most test kits will have AI incorporated. The purpose of that would be and the purpose of screening generally is to check that if there is a positive case, this positive case is brought to hospital, because you won't treat HIV from the house. Okay? The purpose of testing and screening is so that this person comes to hospital. That is why our data, our healthcare data, depends heavily on the data that comes from hospital. But the data that's out there is also very important, and that's why it's important to reach people where they are. In terms of some of the solutions that have come up, there are some flashable STI testing devices, that people can use the comfort of their homes, the tests sent to your phone. When this data is collected like this, and then as we strengthen our Kenya HMIS, Kenya Health Management Information System, we will evolve to a place where contact tracing will be made easier, right? Which is important, that to notify other people, you need to get tested. But that is in that time. Presently, presently, we need to be more open about reduce the stigma. A diagnosis of HIV is not the end of life. And we have medications now that even reduce some of the medications you can take twice a year. only twice a year. We have there are those options.
Yeah.
So when we talk about looking at the hope, that is the hope aspect.
Okay.
And
There's a conversation, sorry, Doc, about injectables.
Yes.
Maybe you want to speak on it a little bit. The injection. Someone was saying you just go once a year and then that's it. You forget about it.
Correct. And I wish we had someone from MNSTCC. But yes, we have, and the government is working to bring in the injections into the country.
Yeah.
Twice. You take the injection twice 6 months.
Yes.
All right? And you're okay. Your viral loads are well controlled, well maintained. And you,
Okay.
It's
and we hope
new advancements.
Yeah.
And we keep getting further advancements, especially with incorporating now AI in gene modification and gene research. We are doing well in terms of solutions for HIV.
Okay,
yes.
I see. And also, Lois, you wanted to say something? Okay.
But also, as much as we're looking on empowering or creating awareness in the community, there's one time I just said, let me not assume.
Okay.
Let me just go around and ask healthcare workers how they feel about this condom couple, how do they feel about HIV. Guess what the response I got? They're very negative. And these are the people, we young people, are depending on them for them to create this platform for us.
Yeah.
You get?
Yeah.
They're very, very negative. I was like, wait, I am HIV positive. Will you treat me like that? And they say, you Chris, you're different. But you get, if it's even the healthcare providers are not well informed or well settled with this, how do you want young people to be settled with this HIV and medication thing? You get? So if we create that environment, okay, where I was taking my medication in Mombasa, we had a youth center, whereby it was more like Maono. There's ball games, there's basketball, there's television games, and young people would come, even if they are positive or negative, they have storybooks. So you will come, do the tournament and all that, and they create awareness, they test, and you see, the hospital is just there, you just link and all that. And they were very informed about all these things you're talking about. Very accommodative, and that's why I'm saying young people, you need youth spaces, you need youth centers, youth zone. Remember, if in the health clinic, the healthcare workers are not have this information that I'm saying, maybe they've not shown it to the clients, but they can talk about it this way. It means there's also intergeneration gap. You see, like there's one young, maybe 16, 17, was pregnant, and I linked her to a health clinic somewhere, and the person who was receiving her was an elderly person. And guess what? Instead of this person giving service to the young one, she started pushing some judgment questions. Why have you started this thing early? Why? It was so frustrating. This girl came back to me and told me, hey, Chris, I don't think I'll come here again. Why? And she explained everything. You see, such things really frustrate us, and that's why we don't even prioritize coming to the health clinics. If we find youth centers where there are youth-like people who are managing it or who are running it, then we will feel comfortable accessing this thing too.
I see. Interesting. So then how effective would you say the approach? Because like you said, you use what, art and football and gains, at least to have as many young people, come in, and probably in the process there's testing, there's awareness, that is out there. So how much would you say this has helped in terms of getting people to get tested, or just understanding, what they need to know as far as HIV needs?
Okay, thank you so much. As I mentioned earlier, we're based in Dandora. Dandora harbors one of the biggest dump sites in East Africa. And with that regards, we also have high numbers of adolescents and young people engaging in matters, gender-based violence. We also have high numbers of teenage pregnancy. And also,
all right, let's sort your mic. Doc, you talked about AI kidogo, okay? So do you want to tell us a little bit deeper in terms of how we can integrate AI? Because then there's the Data Protection Act, that is in place. So how do we go around in terms of, involving AI?
The Data Protection Act protects us individuals and even how we consume technologies. In terms of AI, we are already using AI, all right? And speaking especially to the younger generation, there's a dangerous contraceptive and preventive strategy that's going around, known as pull out and pray. Okay, you cannot have that. Cannot be a plan. I think when young people are glorifying carelessness, it becomes challenging. They already have ChatGPT in their phones. ChatGPT is a very good counselor, by the way. Okay.
Is it?
In terms of information.
Okay.
In terms of getting information. Actually, a study was done in the University of Berkeley, and they found that the information that people get especially on HIV and AIDS, it's good information in terms of awareness.
So they get it more from ChatGPT.
I'm not talking that ChatGPT is the only solution.
No, yeah.
We are also building healthcare bots.
Yes.
Okay, that are focused on counseling and topics like HIV, TB, all right? And these are things that are out here. Okay. All right?
Okay. Liz, I'm curious. Liz, what do you have to say? And probably just also to contribute to your point about how comprehensive it is.
Okay. As I was saying, our strategy of using sports and arts has really been an influence in terms of, number one, creating awareness, because we get feedback from the community, and we also run a youth center, which also attracts 500 young people per day in our center. Okay. So once they're there, we're able to have open conversation, create that safe environment that Chris is talking about, in terms of just us having that conversation. Okay, when was the last time were you tested? And if you want to get tested, do we have the self-test kits? Yeah. Our offices are located near a health center, that is Dandora 2 Health Center. We also work very closely in terms of referring adolescents and young people to go and either get their medication or just get tested. Because like yesterday, I got a young person just asking me out of the blues, "Hi Lois, I'm in Nairobi for the holidays and I am on ARVs, where can I get my medication?" How are we as individuals creating that environment space for young people to just approach us and ask these questions? I have multiple partners. I have a boyfriend, I have someone else, but I'm afraid because probably they're demanding this and this. Can we have that discussion? And with those centers, we create that safe space for them to come to us and also have that discussion.
I see.
With Matters AI and and knowing about, yes, it's a very good platform for us to get this information, but you also need to bring your logic on board. You also need to bring the knowledge on the books that we read, because it just ChatGPT kidogo, it's inaweza ama haiwezi, but we have real data, we have statistics, we have books we can read from, we have experts in this field. How can we not just focus on one aspect in terms of getting our information with regards to this conversation, but also be open in also getting some of the lived experience, because ChatGPT will tell you, go and get tested at this health center.
Yes.
But reality on the ground is we as young people, we are not comfortable going there.
Yes.
Because number one, probably we'll meet someone we know or a health person, a healthcare provider who is older and they might judge us, you know. But on the ground, you'll get that information from maybe Chris or another young person.
Okay, I see that. Listen, we only have a minute to go. Chris, I'd want to hear from you because again, there's, like you said, there's a lot of fear, there's a lot of stigma, but then again, also seeing people like you who come out and say, hey, listen, this is my situation and this is what you can do to, first of all, protect yourself, okay? But at the same time, also champion for things to get better. What you're talking about, medication and awareness and, you know, reducing stigma and whatnot. For someone who's watching you and be like, hey, okay, where do I start? How do I use my story to help other people out there to really understand what HIV is all about and what we can do to take better care of ourselves? 30 seconds maybe before we're kicked out of the studio.
Okay, so my journey has been long and tough, but the first thing I did is accepting the fact that I'm in this journey and I'm walking it either alone or with friends. So accepting, and also there's this support system around us, either family, either friends, either anyone. So support system from the community is also is something that can make you come out, you know? And also understanding your health, prioritizing your health as a young person. I know many people will choose BASH apart, instead of health. Many people will choose maybe doing work or going to look for money instead of health. Prioritize your health first, and then the rest thing will come. Because if I'm healthy, then I'll make money. If I'm healthy, then I'll interact with people. I'll be presentable to people. You will call me if I'm healthy. I'm sure you will not call me if I'm in bed.
You're in bed, surely that would not be fair.
So that's the first thing: acceptance and taking your medication on time, correct. It's just like condom, correct, consistent. Yes. And so you take your medication correctly and consistently, using the time that you're given by the practitioner.
Thanks, Chris. And I'm so sorry because rushing you because, listen, we have to end the conversation here. But it doesn't mean that it ends here, okay? Let's keep the conversation going online as well. And that is at NTV Kenya across all board. But for now, allow me to say thank you, okay? We'll come back again and still continue with the conversation. But for now, we have to say goodbye. My name is Winnie Lubembe. Stay safe, God bless, and we'll see you tomorrow right here on Your World. Goodbye.